At this point, we are going to shift gears a little bit and have a fireside chat minus the fire. And so I want to invite Dr. Brahmajee Nallamothu up and Dr. H.V. Jagadish. Dr. Nallamothu is a professor in cardiovascular disease in the Department of Internal Medicine. He's also director of the Michigan Integrated Center for Health Analytics and Medical Prediction, MiCHAMP, at the University of Michigan. And Dr. Jagadish is the Bernard A. Galler Collegiate Professor, Electrical Engineering and Computer Science. He's also a professor of electrical engineering, as well as the new director of the Michigan Institute for Data Science, also known as MIDAS. And if you guys are ready, I'm going to turn it over to you.
So thanks, Vicki. It's May, and it's Michigan. So yeah, there's nothing better than a fireside chat as summer is kicking off. So as Vicki had mentioned, my name is Brahmajee Nallamothu. I'm a cardiologist and health services researcher here at the University of Michigan and at the Institute for Healthcare Policy and Innovation. And so it's great to be here with Dr. Jagadish, otherwise known as Jag, here, who has a long-standing history of great work on complex databases and multimodal kind of data integration and analyses. And as Vicki had mentioned, he is now the director of MIDAS. And so we had gone through a number of different kind of iterations of what we could talk with you about, Jag. There's a number of different topics. But we wanted to focus on a couple things where we think that your insights and relationships with lots of things that are going on around campus would be really useful. So I'm going to start with question number one that Vicki and I had kind of come up with in this discussion. So, you're now the new director of MIDAS, and MIDAS is all about catalyzing interdisciplinary work across campus between content and methodologic experts. And if there's one thing that's really important about precision health is that kind of combination of bringing content and methodologic experts together to kind of garner new insights. So what we're wondering is, this is a big challenge, and how you've thought about it from the campus perspective and then more globally at successful places that have done this. Are there particular tactics or strategies that different institutions can use and different members and investigators here?
Yeah. Thank you first for having me here, Brahmajee, and thank you for your question. I couldn't agree with you more regarding the importance of having people from different disciplines come together, particularly people who know methodology and people who know the domain. Speaking for myself, well before I had anything to do with MIDAS, maybe 20 years ago or so, I found myself working with colleagues in the medical school at the time that the bioinformatics program here was starting. And I personally found it intellectually stimulating to talk to people who were experts in things that I knew very little about, and to learn from them and to work together with them on solving problems that none of us would have been able to do alone. I think that there are many barriers to interdisciplinary collaboration. It takes time to establish a common vocabulary, to establish a common shared objective that people want to work towards. And I think that what we've been trying to do in MIDAS and that you've been trying to do here at Precision Health is to try to create opportunities for people with different types of skills, with complementary skills, to interact. And some of these interactions click and turn into productive efforts, usually because there is some grant proposal that somebody can put together and needs to have certain kinds of things covered. One can't legislate this. I think that what organizations like PHI and MIDAS do is encourage it and facilitate it. And the more we can do it and the more that people are able to establish such collaborations, I think the more successful we'll all be.
Are there unique things like, one of the things I know being involved with precision health has been creating examples of common things to work around. So under the leadership of a lot of folks in precision health, aggregating data, for example, in Michigan medicine. Has that been something that MIDAS or others have kind of thought about as a path forward? Because as you mentioned, everyone's busy, everyone's doing great work, and trying to kind of force collaboration can sometimes be a challenge in and of itself.
Right. So I think if one is going to create opportunities for interaction, a good question to ask is, what does an opportunity look like? And having, talking to somebody at a cocktail reception is one level of interaction. Talking to somebody about a common goal, say towards establishing, doing some kind of data aggregation or solving some other problem or studying some other topic. I think that creates an environment where the shared interaction, even if it's between the same people, same set of people or pair of people, is more focused. The conversation is about the kinds of things where it's more likely that people will find those research hooks and those commonalities, those points of contact that might get people working together. So yes, I think that having topical notions is good and important. At least speaking for MIDAS, my belief is that we won't have one or a very small number of topics, because we need to serve the breadth of the Michigan community. And so, yes, topical, and we try one topic and see how many people gather around it, and we have, and we continue with, and we run with topics where we get people interested, and there'll be others where things don't work, and that's okay.
Yeah, fair enough. So shifting gears a little bit, but still talking perhaps about one of these opportunities has been, at least from the precision health space, the idea of creating a data asset, right? That's something common that people can work with. One of the challenges, and this is something kind of in the straight area of what your background has been, is on establishing issues around data provenance. Obviously, we need a historical record of the data we use, its origins, especially if we want to ensure reproducibility and replication. If you could talk a little bit more about how MIDAS has thought about this, how your own work has informed this, and what you see, because if I query, for example, the research data warehouse right now, and I repeat that same query in 6 months, it's a different data set, and yet that has implications for how we think about our analyses and the structure of our work.
Yeah, I think reproducibility is a really important question, and one that has actually many layers of meaning, and perhaps different angles from which one thinks about it. There are issues of computational reproducibility because the data set changes, things got added to the warehouse. There's reproducibility in terms of statistical reproducibility because of natural variance. There's reproducibility just because of experimental errors and so on. So I think there are many different places that one talks about it. We in MIDAS just 2 weeks ago or so, maybe a little longer, 3 weeks ago, had one of these topics around which we had to get together was reproducibility. And we had over 30 people in the room from all over campus, and I think we identified a few different subtopics, even within the broad umbrella of reproducibility, that subsets could focus around and think more deeply about and make progress on. And that's stuff that we're going to be doing in the coming weeks. One of the aspects of reproducibility is provenance, which you mentioned. So provenance basically is being able to say where something came from. And when you have data, you want to know where the data came from. It might be primary data that was directly recorded by a sensor or by some experiment, but much more often the data is whatever every data item is the consequence of a pretty long sequence of computational manipulations, having started from some initial data record that somehow got created or was obtained. And keeping track of all this is important if one wants to investigate why anomalies were observed or things of this nature. It's at the heart of being able to assure reproducibility, being able to explain the results one has obtained. And the challenge in terms of maintaining provenance, there are a couple of challenges. One is that there's often just too much information that one needs to record. This could be the entire software package that you used matters, because if you use a different version tomorrow, that might give you different results in general. And you need to be able to guarantee that it will or it won't. So there are things of this nature that make it quite tricky. I think that this is an area that I've worked on, and so it's very easy for me to sort of go too deep and technical. Trying to stay away from that, just in terms of best practices and what one does here. I think that there is it's a twofold thing. I think that on the one hand, in terms of setting up systems, one should set up systems that make it easy to record provenance and metadata as one goes through. So, laboratory information management systems of various types, eLab notebooks, things like this, will often automatically record at least part of or significant parts of the provenance that one creates or that one needs in terms of the data. I'm involved in a project with ICPSR, the Inter-University Consortium for Political and Social Research, where statistical manipulations of survey data, where the person as the analyst creates the statistical manipulations, as a byproduct, the provenance gets recorded using the metadata standard that ICPSR has for their repository. And so having these kinds of automated things can greatly reduce the human burden of creating the necessary information. Of course, there's the human burden, which is the flip side of this, which is it's never going to go to zero, and it's important that people think about what one needs to record and make sure to record it, even if it appears to be not that important, not that valuable at that time, because it just turns out to be so critical when one wants to get back to it at a future date.
So it sounds like, though, that there are going to be some central ways of kind of helping with data provenance and not just leaving it up to investigators to kind of sort this stuff out on their own, whether or not led by MIDAS or maybe things that we should even think about within Precision Health.
So one of the things that I hope that we will do is actually have some kind of help and guidance, at least in terms of best practices recommendation. I don't want to promise that we'll do it, and certainly I'm not yet at a point where I can say, hey, it'll be ready by the fall or something like this. But that's certainly something that I've been thinking about. We've had some preliminary discussions about, and I hope that we will be able to do within in the next months.
Great. Well, you know, shifting to the last topic that I think would be really interesting to get your insights on, a big area of research for you over time has been on security, and this is something that's at the forefront. You know, one of the roles I have is to work with Dr. Jenna Wiens to kind of lead the analytics work stream within Precision Health, and it's something that constantly comes up. You know, it's this balance between kind of hoarding the data for protection reasons and then being, I think, irresponsible stewards of it. And I think this is particularly important because we have kind of this itinerant group of people we call students that kind of come through campus and help us and work on this and do wonderful stuff with this. But they're here for a short time, you know, making data openly available, but, you know, having restrictions on that. And I'm kind of curious, as you've thought about it, from a standpoint of, you know, there's cultural things about how you care for these data, but there's also technical controls and things like that. And I was wondering if you could share some thoughts about that.
Yeah, I think that issues of privacy, of course, are tremendously important. I want to relate this actually to the previous question of sort of being able to have transparency, which is one of the aspects of reproducibility that people talk about. If one moves away from health for just a minute, and one, for instance, talks about e-government, okay, if I ask you, would you like to have your government be transparent and have data public? Most of us would say yes. Okay, we want transparency. Okay, and then if that transparency means that some of your private data, which the city has or the county has or whatever the state has, is now being made public and easily searched, then now you might feel a little squeamish about the same thing. Okay? And I think that public agencies are struggling with this challenge of wanting to do the right thing in terms of being open while at the same time protecting citizens' data. And I want to talk about that as an example because that is a thing where we're all citizens, so we can understand both sides of the coin and the pressures that come. If one looks at sort of traditional medical practice, we have similar issues where you want to protect patient privacy, and you don't want patient privacy to get in the way of care delivery. And so the usual way in which most medical systems I'm aware of are set up is there is a certain protected level 2 or whatever, a box, and once you're trusted to be in there, then you have access to everything. And if not, then you don't. And this way, you sort of make sure that the care provider isn't getting locked out of things that they might potentially need at the point of care, just because there was some privacy restriction. And then you hope to deal with bad actors, and there will be bad actors, through an audit process, okay, which comes after the fact. So you're not preventing it. You're hoping that the number of bad actors is small, which is probably true, but that's just how that system is set up. Okay? Now, if we want to say that we're doing data analysis of medical data, and we're doing this not to provide care, then you have to say, what is the universe of people who need access to this data to be able to perform this analysis, and under what circumstances does one provide this? And I'm stating this without even looking at all of the complications because of regulatory restrictions and HIPAA and all of those, right? Just as a pure, even without all of those coming in, just as a pure common sense thing, one has to say we want to protect patient privacy, even if whatever be the consent, whatever the story, right? You still want to protect patient privacy to the best extent possible, and you still want to be able to ask all the research questions you want to ask. And this is a very tough balancing act. One place, for example, and you make assumptions. So one thing, for example, that some places do is to say, if you have a question to ask and you specify a cohort that has specific types of conditions, then that's a query within some limited number of patients, and then you can be consented to get that much data. Well, that works very well if the question being studied is one that can be posed in terms of a population that has some condition or not. And yes, many medical questions can be posed that way, but there are many that aren't posed that way. And if they aren't, then you don't have a setup for somebody who wants to ask questions that don't fit in that box to be able to work with this data set at all. So there are these kinds of things that one needs to think through when one says, what is the access modality that one wishes to allow? This is a careful balancing act. This is a very hard thing to do. And in the medical space, this is particularly challenging because of regulatory requirements and consent requirements. But I think this is one where we need a lot of smart people trying to address this. I realized that I didn't address one other thing which you said, which is what are technical solutions that one can have. There are some. There is research work on this. I think that we are sort of on the cusp right now of having pretty good provable things in certain circumstances of having what I'm calling semi-synthetic data, okay, which means the data are not all completely made up. They're based on real data, but they're sufficiently differentiated from real data that you can't use the data that you see to actually identify somebody or to get the actual real thing. But you've introduced the perturbations in the data in certain principled ways that you can provably say that certain kinds of analyses will have an error less than something, right? Mm-hmm. That's the kind of math that one needs to go through. This isn't going to work for everything, and this is always going to be for a class of analyses for which you have shown that the perturbations work. But I think that that's an exciting frontier to me, because that allows us to create data sets that can be widely shared, and therefore enable at least some classes of analyses easily.
No, that's great. No, and I think that this idea of the semi-synthetic databases is really one that is gaining traction, but then also ensuring that there are protections around the true data sets too. And it's definitely a balance we struggle with a lot within our own analytics work group, but I know that it's a more broader problem too. So I'm going to leave you with you're now taking over MIDAS, and you've been kind of on the clock now for several months. Do you want to share any kind of big things that you're thinking about in the coming year? Any kind of plans that you have?
Yeah, I think that data continues to be really important. I think that I don't need to say that to the people in this room here. Mm-hmm. AI is the buzzword in terms of what people are doing with the data. Again, I guess that everybody sees that. I think that in terms of MIDAS activities, The precision health and related topics, the health sciences in general, and data questions in the health sciences are very important. Of our 9 large challenge grants that we've done in the past, 3 are in the area of health sciences, including one that you led, Brahmajee. And I certainly hope that Midas going forward will continue to contribute strongly to sort of data-driven research activity in the health sciences and to complement the efforts of the Precision Health Initiative.
All right. Well, thanks, Jag, for taking some time and answering some questions. So,
thank you very much for having me.
all right, everybody, stay warm.
Yes.
Sachin?
Any examples of places or organizations that are balancing the security, privacy thing well that we learn from? We don't have to reinvent the wheel here. The places where, even in engineering, healthcare, any industry where it's worked well.
So I'm just gonna repeat the question at the mic. So the question from Sachin was, are there any places that are doing the data security really well so that we don't have to reinvent the wheel?
So I think one of the most public attempts at this is at the Census Bureau right now. They're really doing interesting stuff, cutting edge stuff. So as you know, the Census Bureau collects a lot of data, and by law, they promise not to share it with anybody, even with other branches of government. And that is part of the promise they make to you, and why they hope to, and that's their hope that they'll get good, clean information where people aren't lying on their census forms. In the past, and they release aggregate data because the aggregate data is something that a lot of people use for various purposes, and they have techniques for determining what level of aggregation is something that they're comfortable releasing and so on. A thing that they have promised to do and are doing a lot of technical work on to do for the 2020 census is to use a technique called differential privacy, where they will release aggregate information at various sizes of aggregates. So earlier it used to be an all or nothing thing. Above something, you get all the aggregate information, and if you ask for micro aggregations below something, then you won't get it at all. Now you can, but the smaller the aggregate you ask for, the more the noise that gets added to it. And you can mathematically determine how much that should be. And this is a brave new world. And if you talk to social science researchers, you'll see some people who are really excited about this, and others who think that this is going to make their research impossible. And I think all of this is good for MENT. A bunch of smart people trying to figure out a new way of doing things. I hope that they are successful. It's a very difficult challenge, and I really applaud them for their efforts.
I'll follow up on that. We were just talking earlier. So Sachin, there's a group, and our journal is publishing this article where they've used differential privacy as well as adversarial networks with machine learning to generate semi-synthetic data. And they did this with a publicly available data set, the SPRINT data, which was released by the New England Journal of Medicine and the SPRINT investigators. And it is super exciting. But at the end of the day, what's really fascinating is how they can actually manipulate the level of identity that's left in the data. But the question is investing resources in developing that versus investing resources in creating a more protected sandbox where people want to work on real data at the end of the day. And I can't tell you, that's a tension every meeting And we even within one meeting go through a cycle of like, let's just get it all out there. No, let's not do anything, you know. So this is a really ongoing challenge, so.
Yeah, by the way, I think that differential privacy is still technology at the cutting edge that people are working out, and I really give credit to the census. You know, it's a big operation, and it's one that is extremely visible, and so, you know, a lot of people are risking their careers on it, but they're putting in the due thought required to be able to try to do this well, to do this right.
Can I ask your opinion about, like, so one thing that we thought about is like, maybe we're trying to create one solution for lots of problems, right? So an example would be someone who's an investigator trying to do research, has, you know, the ability, a history of doing that, and also has some skin in the game because they might be a PI and things like that. And then there's students, because we have a huge educational component. And thinking about like maybe the semi-synthetic data sets are more aligned with you just want to generate data, let people play with it. Have you thought about like how that fits into it and the roles of it? The student issue is a real challenge for us because we want to be very open. We want to have data that's made available. But at the same time, understanding that that's another level of kind of commitment and, you know, what data and how they manage the privacy. I don't think it's because of anything intentional, but it's maybe about education and allowing them to understand how important it is to maintain these issues.
So as far as student access is concerned, we see this all the time with respect to proprietary data. Okay, so this is not personal privacy, but, you know, company proprietary data, for instance. And the standard practice is, you know, faculty sign licenses or agreements and are responsible for making sure that students in their group abide by it. And they're signing on behalf of the research group that they lead. They're not signing on behalf of themselves as individuals. And so if you're talking about students who are involved with research, which is presumably the class of students you're talking about, I think that they're part of the research team, and they're supervised, and their supervisors are the ones who take responsibility. I really don't see an issue there.
Great. Well, thank you both.